Hi, everyone. My name is Sarah Barker, founder of Connect Our Elders, and I have David Chong, the founder and CEO of Coast Care Partners. It is a non-medical home care organization covering all of San Diego County. And what we're going to be talking today about is the Respite Well program. They are the only home care organization that has this program. And so I'm really excited for this information to get out to the community and certain partners that help elders in our community. So David, if you don't mind, please explain the Respite Well program.
Sure, I'll take it from the top. Thank you, Sarah. Good to be here. Let's see. So the Respite Well program is a San Diego County program, and really the genesis of it was with Supervisor Jacob, longtime East County supervisor, and several years ago, she brought this to the county, and the county's idea, her idea, was to create a voucher program where for senior care, the county would match dollar for dollar with consumers who need to buy senior care. That's the bottom. And the senior care can be home care or adult day program or assisted living. And the bulk of it has been home care. So the county matches dollar for dollar, which essentially makes it half price for consumers to purchase respite care. The consumer, it was designed as an Alzheimer's and related dementias program. For qualification, we use kind of any kind of cognitive frailty, right? Which can be caused by a lot of different factors, but it's cognitive frailty that kind of qualifies of having dementia. And then we do a little caregiver stress scale, which we debated when we designed the program of, should you have to have a certain score on stress? And we realized, hey, if you're a caregiver of somebody with dementia, you're going to have stress. So as part of the county's program, we measure that. But so long as you're a caregiver with somebody with Alzheimer's related dementia, and you have some stress that shows up on this little interview we do, then you qualify for the program.
I think it's worth mentioning also, because I know sometimes families feel as though their loved one has to have an official diagnosis already of dementia, but that's not the case, right? Like if there is cognitive impairment, caregiver stress, at least reach out to Coast Care Partners and have a consultation, because you guys are using the MMSE, I believe it is.
Correct. Yeah, and there's been and actually a diagnosis can replace using the MMSE, right? So if you've got something from a doctor that says we've got Alzheimer's or Parkinson's or multi-infarct dementia or whatever, diagnosis can take the place of that. But yes, to your point, Sarah, if it hasn't been diagnosed. Actually, that question comes up a lot. If it hasn't been diagnosed, we're happy to do our MMSE. The other question that comes up a lot is there is no income qualifications. The county set it up so that the program is available to any stressed caregiver here in the county. There's other programs for kind of either the lower income or financially stressed households. This one was designed for any. I was gonna say any taxpayer, but frankly, it's available to anybody who's in San Diego. Really, it's just there's no income qualification. So we have had kind of people across the entire income spectrum who've been able to benefit from this county program. So
it's an amazing program. I mean, I'm so amazed by the program. So would you like to talk, I think it would be important to share the effectiveness of the program as far as how I know you guys have tracked data, is it helping to lower readmissions into hospitals? What has the impact been on the families that you've been serving through the program?
Yeah, I brought some data close to me, but I didn't bring that one. We do track several different points. Reduced readmissions has been a big one. We were I made that point last year. I want to say I don't even want to guess at it, but it was all I can say. I can forward this to whoever wants to email me and ask. But for average readmission rates in San Diego, we cut those like in half or a quarter or something like that on our Respite Well program. I apologize, I don't have that close at hand. So we have cut readmissions. We do a survey of all of our participants about whether it reduces stress or not, and 90% of them says, yep, it significantly reduced my stress, made it easier to take care of my loved one. We get, the most powerful is we get comments back on those surveys as well. And there's one I shared with one of the supervisor's offices the other day, and the family caregiver says, the first time I've slept in the night in years, kind of thing.
Yeah.
So, there's stories like that, right? So
that is powerful. Big impact. And I think that You know what? So what people need to know is that it really has played a role in reducing readmissions for many of the clients that you guys have helped, right? So it has reduced readmissions for a couple of reasons, right? So maybe that person was probably resistant or didn't feel like they wanted to spend money on caregiving, right? And so then they said, okay, well, this sounds like a great option. Let me test this out. Right. And so it's effective, making sure that they're, in compliance with things and making sure that they don't readmit, right? Safety.
Yeah.
But
Sarah,
also,
no, I don't want to cut you off, but It made me think of something we learned very on about this program is that it gives people permission to receive help. And your point, Sarah, I think what you're making the point of, that people are hesitant to receive help or start the care. And this program has been, hey, look, the government, the county recognizes that, you get stressed and it affects your health. And actually one of the first things when I first got into senior care 20 years ago and I researched about Alzheimer's, even back then they were saying the number one thing you can do for an Alzheimer's patient is take care of their loved one, they're the primary caregiver, like make sure their health is good. So this voucher program, it's the county, sending the message and giving permission that, yes, spouse, yes, daughter, take a break because, your balance and health makes a difference. And a lot of people, it's been the kind of nudge that a lot of families needed to
that's a great, concise way of putting it. It is sort of that nudge of, you do need this. And a lot of them feel like they need it, but they, the whole psychological aspect of feeling as though they've been given permission to get support. So the satisfaction of the families, the testimonials, I do encourage people to go ahead and look at the website. And I know you mentioned that if they want to see the full results, that you guys are able to send a report to them.
Yeah, we've got a little slideshow that talks about how many families, the average vouchers, a little map with the geographic location. I'm happy to send that to anybody, really. It was something we prepared kind of for I'd be happy to share that.
And where can people go to learn more about the Respite Well?
Yeah. So we set up a website long ago is respitewellsd.com. Again, respitewellsd.com. And so that's got our most current, information about it. There's, links there to our email and things like that in case you want to see the full report on it. But that talks about like the current benefit levels. Like currently care for home care is at $15.74 an hour, right? And which is, again, that's what the consumer pays, and and then the county pays the other half. Assisted living, you get $144 per day. So what the consumer pays relative to what the county pays. So that's all our information kind of on the website. Give some benefit levels on there. I probably should add a couple things that it's a pilot program of the county. So it's gone on for 2.5 years. But as a pilot program means that we've adjusted benefits as time has gone to best fit what everybody needs. So, benefits change from time to time. So until you're signed up and in the program, the benefits levels are subject to change. And the one other point I'll make related to that is, the county funded this with $1 million a year, from the county. And we found that the funds can run out quickly in terms of what the community needs. So when the county's funds come to a limit, then there has been a wait list that started from time to time with our program. And so what we've done, we try to adjust the benefits to reduce the length of the wait list or eliminate the wait list. So a lot of our tinkering with the benefits has been related to that. Literally just yesterday, I was back and forth with Aging Independent Service quite a bit. The news item of this, if you make it newsworthy, is, with the federal COVID funds that have been going out to cities and counties. So you may know, the county has had kind of a budget surplus this year. Mm-hmm. We're looking at the most effective places to spend it. So, both the different supervisors' offices and AIS have been coming back to us of like, hey, how's this program going? And we're saying, hey, it's like, I don't want to say insatiable demand in the community, but there's just a lot of families who have needed and wanted this. So it's kind of in the air that there might be additional funding coming.
I'm so excited because I've been saying for the last two or 3 years now, right, that I hope that they could increase the budget for this resource for the community, because you guys are stewarding the funds appropriately and effectively for the community. But there is such a need, and the program is making such a difference, not only for the families, but the healthcare systems too. It's phenomenal. I want to make sure that I point out to those listening, because people do ask this question, right? Well, are there different caregivers for this program? And so what I want people to know is that there is not a decrease in the quality of the caregiving just because you're getting the care through this program. It's still the same caregivers that are with Coast Care Partners. They're W-2'd employees. You have all of the same liability protection, all of the same oversight from the scheduling department, the care management team, everything. So just because you're using that program does not mean that you're going to get, some sort of diluted service either.
Yeah, the service we provide, whoever it is, respite well or otherwise, fits within who we are and our values and the infrastructure we put in place. You're spot on. Yeah.
Awesome. Well, thank you so much for sharing that information.
You're welcome, Sarah. Thank you so much for having me.
You're welcome.